And I once attended a forum, and there were discussions that were taking place about what's the future of the Northern Cape now that we are running out of diamonds. The future of the Northern Cape beyond diamonds. So I was asked to make an input and a reflection. So I told them I don't understand the topic for starters. The future of the Northern Cape beyond diamonds. That topic I don't understand. So they tried to explain to me what the topic means. No, there used to be a massive extraction of diamonds in the Northern Cape. So the Northern Cape is running out of that mineral. Well, what's the future of the province? I said the population of the Northern Cape is 1.24 million. And each and every one of those individuals from the Northern Cape is a diamond. Each and every one of us is a diamond. So you can't be having a topic of a future of the Northern Cape beyond diamonds. The diamonds there in the Northern Cape. And there's one of our pristine and shining diamonds from the Northern Cape. And I could not really hear you giving her a good, nice round of applause. And thank you very much for joining us today. And thank you very much. I highly appreciate your commitment to issues of mental health. We firmly believe that we must embark on a struggle to destigmatize mental health and also to focus our efforts to ensure that in the Northern Cape there will never be a tragedy like the life of a city. That's what we'll have to ensure. That will never happen here in this province. And we should derive lessons from what actually happened in Gauteng. So we highly appreciate your commitment to the most vulnerable in society. We also invited the families of the patients, because some of the patients have already been moved to this facility. Where are the families of the patients? Or some few members from the families? Are you happy with what you see here? No, the families are happy. Members of the public, members of the media, ladies and gentlemen, I'm delighted and honored to join the people of the Northern Cape as we mark the official opening of the mental hospital. I'm confident that the new state-of-the-art facility here at this hospital will radically improve the quality of health care provided to our people, especially those who do not have access to quality health care, the working class and the poor. We must use health economics to reignite our local economies. Just next to this structure, we are constructing a nurses' home. We are also constructing a nurses' college, and we've got temporary structures for emergency medical services. And we are going to construct permanent structures for Emergency Medical Services College. These are massive infrastructure projects that will positively contribute to the GDP of the province, and particularly Kimberley. So there's a number of construction projects which are taking place here, and particularly around here. And I'm certain some of you have seen that we are busy building a nurses' home. We are going to build an emergency medical services college where we'll be able to train young people to work from the Northern Cape to work in this field. And one of the issues which I have pertinently raised with the MEC of Health and which we must work towards is to ensure that we build a district hospital here in Kimberley to alleviate pressure on Robert Sobukwe Hospital. Because the biggest problem at Robert Sobukwe Hospital is that people move directly from the streets to a tertiary hospital. And that puts pressure on that tertiary hospital. So what we need to do is to build a district hospital that will actually refer people to Robert Sobukwe Hospital. That will assist us to alleviate pressure at Robert Sobukwe Hospital. So next time in my engagements with the Department of Health, I should be able to get concrete plans on how and when are we going to build a district hospital here in Kimberley to alleviate pressure on Robert Sobukwe Hospital. We know that the road we traveled to arrive at today was definitely not easy. It was a long and winding road full of pitfalls, characterized by huge wastages of state resources. We commit that such will never be repeated in the Northern Cape. Hence, we are introducing intervention programs to strengthen the capacity of the state to plan, design, and implement major infrastructure projects more effectively and in cost-efficient manner without unnecessary wastages. Whilst we also celebrate the opening of this hospital also stands as a monument of corruption at a large scale. We need to be very honest about it. The monument of corruption, of what corruption can do at a large scale, unprecedented. Construction of this hospital started around 2008. Cost estimates of 300 million with a construction period of about 3 years. Today, almost 12 years down the line, with total cost of 1.3 billion rand. Billion rand more than the initial cost of constructing this hospital. So what actually happened here is an indictment on all of us to put an end to it and to make a commitment that it will never happen again. Yes. It will never happen again on our watch. With what we paid here as cost overrun, we could have been able to build 3 similar hospitals in the province. So we should never allow this to happen. And as the Premier of this province, I must make a commitment here that this will never happen again. And we have to investigate what went wrong in the construction of this hospital. What is it that led to such massive wastages of public resources? Program Director, for many years, mental health services has been neglected. However, such neglect was not only in our country or in our province, but for the whole world. This is because mental conditions have been typified by varying degrees of social stigma, marginalization, and substandard services. As we stand on the threshold of the universal health coverage and the national health insurance, I am able to say today that we in the Northern Cape are committed to radically reversing the situation of neglect of mental health patients. It is therefore with great pride and honor that today we cut the ribbon to ensure that without further delay, our people have access to quality mental health care. Program Director, cutting the ribbon signifies the opening and operationalization of the new Northern Cape Mental Hospital. It is a facility that has costed us about 1.3 billion rand to complete, but it has emerged as a truly remarkable state-of-the-art healthcare facility, a symbol of transformation, and must be a center of excellence. This facility must restore dignity to the most vulnerable and the most fragile people of our society, the mentally ill. We can only achieve that if we commit to the 3 essentials of public service. The 3 essentials of public service which I want to highlight here. The first of them is to be of service to the people. And the second is to be pragmatic. and the third is to keep integrity. Ladies and gentlemen, it is significant today that this event is being held on the eve of October, the World Mental Health Month. Historically speaking, psychiatric services in the Northern Cape has been highly fragmented. Previously, they were provided with facilities in Bloemfontein and Cape Town. In 1991, the present West End Hospital in Kimberley was opened to provide acute, chronic, and outpatient psychiatric services. Although this was a major step, it has fallen short of the norms and standards set out in the new Mental Health Act and the accompanying legislative reforms. The new mental hospital has a capacity of 287 beds and will be operationalized in phases over the medium-term framework period to provide for a full package of specialized mental services. These services that will be provided in this hospital are child and adolescents mental health services, forensic mental health services, general adult psychiatric services that includes outpatient services, services for comorbid patients, services for victims of substance abuse, and services for private patients. Currently, 160 clinical operational mental health beds have been successfully migrated from Old West End Hospital, and 20 more are anticipated for forensic observation and child and adolescent mental health care. Can we give the Department of Health a nice round of applause? We've been able to migrate 160 of our patients from West End Hospital. And I'm certain you that was incident-free. We've not received a report of any negative things or incidences taking place when those patients were migrated to this facility. We have appointed 70 security personnel as part of in-sourced service. So what we did as part and parcel of operationalizing this hospital, 70 security personnel have been appointed, not working for a contract of somebody, but they will be working for the state. They have been in-sourced. And we've been getting all prophets of doom telling us that the insourcing of security guards, cleaners, and people who are doing gardening services for the provincial government, it's impossible. And we've started with that program, and we are going to implement it successfully as the Northern Cape provincial government. We have further appointed additional staff to cater for the needs of the hospital in areas of psychiatry, psychology, medical officers, nurses, social workers, and pharmacists. More clinical appointments will be completed by November this year to ensure the migration of the remaining 39 state patients at the West End Hospital. Continuous development and training of medical staff in mental health care issues is a fundamental importance. And so far, 24 primary health care medical doctors have received training on the management of medical health disorders. And training in partnership with the Department of Health has been provided for over 200 medical officers and professional nurses from all hospitals that have been identified to have mental health care units. Ladies and gentlemen, it is worth noting that in the medium and long term, the new mental health hospital will make it possible to address key challenges outlined in the National Mental Health Policy and Strategic Plan 2013 to 2020, such as scaling up decentralized integrated primary healthcare services, including mental health care, increasing public awareness regarding mental health and reducing stigma and discrimination associated with mental health, promoting the mental health of the population through collaboration between the Department of Health and other sectors, empowering communities to participate in the promotion of mental well-being and recovery within the communities. Program Director, allow me to dwell a bit on the most critical aspects of service environment of mental health care in the province and the immediate tasks that emanate therefrom. The outcomes of the National Mental Health Summit held in 2012 indicated that one of the key challenges in mental health continues to be the lack of professional leadership and management. In order to reverse this, a dedicated mental health directorate is in the process of being established through the advertisement of critical positions. I gave a clear instruction to the Department of Health that we must fill all critical vacant positions for doctors, nurses, psychiatrists, and psychologists. All those positions must be filled, because it does not help us to put up such state-of-the-art facilities and you don't have the doctors, you don't have the necessary nurses, you don't have the necessary human capacity to attend to the needs of our people. Then these structures, they will just stand here as white elephants. So it should be structures and facilities that should be used to render effective services. And in order to do that, you need doctors, you need nurses, you need people with the necessary and relevant skills to attend to our people. So I told the HOD of Health and the MEC of Health, I won't mind if I'm told that Department of Health has got an over expenditure of 1 billion rand. As long as it is an over expenditure for appointing nurses and doctors in the province. So when it's about appointing nurses and doctors, nobody should come to me and tell me we don't have money to do it. We must have doctors and nurses in the province. Ladies and gentlemen, mental health care is grounded in the new prescripts of primary health care as defined in the primary health care re-engineering. In accordance with this, mental health care is community-based, hence it is a strategic objective of the universal health coverage to establish district specialist mental health teams consisting of psychiatrists, clinical psychologists, occupational therapists, social workers, and psychiatric nurses. So we are expecting community members to also participate in these mental health teams, which will be based in the different communities. Indeed, Program Director, this will be a mountain to climb, taking into consideration the difficulty we have in attracting specialists to our province. Nevertheless, we are committed to addressing all these challenges. We are not here to look for easy tasks. In the same breath, beyond the opening of this landmark new facility, upgrading of other infrastructure units of mental health care is critical, and the province has already identified 11 hospitals which will be refurbished to accommodate mental health units as part of the decentralization unit model. I must emphasize that given the vastness of our province, the decentralization model of mental health care will work best for us. Therefore, whilst the new hospital will serve as a vital point of care for mental health, it is by no means intended to centralize mental health services. On the contrary, as a support base, it will actively promote the decentralization of mental health services. With regards to strengthening the information systems, evidence and research for mental health, we commit towards improving mental health technology, equipments, and medicines. in collaboration with a service provider appointed for patients' administration system, the hospital is earmarked to convert from manual to electronic filing system. This is in line with our vision of building a modern province. So the electronic filing system of patients' information should not only be in this hospital. It should be in all clinics, all district hospitals, and including Robert Sobuk. We need an electronic filing system. We can't be speaking of building a modern, growing, and successful province, but we are deep there in the 20th century, where we are working with paper files. If somebody goes to a hospital or to a clinic, the nurse or the administrator, they must run around looking for the file. Where is this file? And with the likelihood, 90% likelihood, that you won't get the file. Now you must fill up pages, like papers again, for a new file. I met a patient there at Robert Sobuk who told me that every time she goes to the hospital, 82 years old, every time she goes to the hospital, she must fill a new form for a file, patient file. So that must come to an end. That must come to an end. We're in the 21st century. So our first and urgent task is to drag the entire Northern Cape out of the 20th century into the 21st century, into the digital era. That's what we are supposed to be doing. That is the reason why we've signed a collaboration agreement with the provincial government of the Western Cape. They managed to have electronic files, including in clinics. There's electronic files. District hospitals, there's electronic files. If I go to a district hospital and I just say I'm Zamani Saul, they ask for my ID number and they get the file. No delays. And we are channeled through to get medical attention. So we are going to the Western Cape, myself and the Ministry of Health. Go there, finalize our arrangements to come and introduce that system here in the Northern Cape. So seeking for best solution on how best to improve the quality of lives of our people has got nothing to do with the political parties from which we come. It's got everything to do with what is best that we can do for the people of the Northern Cape. As I conclude, Program Director, I want to commit our government's recognition that good health is critical in enhancing human development and facilitating the process of economic growth and development. It is for this reason that we are implementing reforms in the health sector with a view of improving the quality of healthcare services to our people, especially the working class and the poor. The NHI must equalize access to quality healthcare for all, regardless of whether one is employed or unemployed, and regardless of whether one comes from a rich or a poor family. We have observed an attack on NHI. At the heart of those who are opposing the introduction of NHI are private monopoly financial interests and major companies in the private finance health industry. Some of them are listed in the Johannesburg Stock Exchange. They make huge profits at the expense of our people. According to them, people who do not have money must be left to die. This is not only inhuman, cruel, but goes against our fundamental principles of Ubuntu. The NHI must bring an end to this class inequality in healthcare. It is a chance for South Africans to contribute to the collective health and well-being of one another and to extend access to quality healthcare to everyone. Ladies and gentlemen, as you all know, this medical facility has been long in the waiting. However, today, we have a facility counted amongst the best in the continent, and one we can truly be proud of. It is therefore my humble request that we should treasure all our state facilities and take ownership of them. They are here to serve our people, and this facility especially will serve the most vulnerable in society. Take care of it, protect it, and let us develop it into a center of hope and light in the darkness as we march on towards the creation of a modern, growing, and successful province. I thank you very much.
Thank you very much. Give me up. As we are about to conclude, it just brought to my attention that Dr. Kirin is with us here. Thank you very much, Dr. for joining us. So I think I wanted to put you on the spot. So it's a good thing that they informed me that you are present, you have joined us here. We are all in this together, this partnership moving forward. And Dr. Bringer also said that NHI is here, we will working together moving forward, all of us. So the band will give us an item that will outline the process from here. We are going to request the MEC of Sports of Public Works to do a vote of thanks.